There's a consensus that there's going to be healthcare reform in this country, and there's three key pieces to that. Insurance reform so that people have coverage, delivery system reform, and payment reform. And one of the big pieces of delivery system reform is assuring that everybody has a medical home, and they're going to change the payment mechanism to support that. The problem is that in all of the policy conversations going on around the country, they haven't really thought about where mental health and substance use fits into that picture. So as the National Council has thought about this and thought about the fact that people with mental health conditions, serious mental health conditions, die 25 years sooner than people in the general population, we've given some thought to what a healthcare home would look like. And essentially what we're looking at is saying that the mental health system has to, at a minimum, assure that it is doing regular screening of health indicators such as blood pressure and lipid conditions and whether or not people have diabetes. And they should be being sure that everybody has a primary care physician. Going further than that, what we've said is that it's possible for mental health centers to become healthcare homes, and that we should work to be sure that that happens in the policy framework that comes forth over this next year. And mental health centers as healthcare homes could do that either by bringing primary care capacity into what they do and providing broad primary care services, or they can do it by partnering with a primary care clinic. So together they would provide healthcare home services to people with serious mental illness. And the way that would work is that in addition to doing the kind of screening that I talked about for blood pressure, for glucose and so on, they would also deliver primary care services in the mental health center. They would have nurse practitioners and physicians delivering those services in the mental health center. Another important piece that they could add is to have nurse care managers who help people think about all of their health conditions, because many of the individuals we're talking about have diabetes, they have cardiovascular disease, and they have serious mental illness. So a nurse care manager is well positioned to help someone think through how they're going to manage all of those parts of their lives. And the last piece we need to do is to put in place wellness programs. We need to start providing smoking cessation programs, nutrition programs, physical activity programs. We can use peer counselors as a big part of doing that work to help people get engaged in managing their own health. So those are the key pieces of the healthcare home. And all of that has been laid out in a paper that the National Council has just published. And we hope to see the members of the National Council using every opportunity to begin to work in this new and really important arena.